Hi, I'm Tom Clough and I'm a dentist that works at Sharrow, Advent and Springfield dental practices. First, I want to say I'm sorry if you've had to have a tooth removed today. I do know how you feel. My father actually removed 2 of my wisdom teeth, so I do know a little bit about what you're going through. It's perfectly normal for you to feel a little bit of pain after having had a tooth extracted. So we will want you to take some painkillers straight away before the anaesthetic's worn off. If your anaesthetic has already worn off and you're in a bit of pain, don't worry too much, but just start taking some normal analgesics you can get over the counter, paracetamol, ibuprofen or cocodamol, and follow the instructions on the packets. After tooth extraction, it is relatively normal to get a bit of bruising and swelling over the next couple of days. So don't worry too much if you have got any of that. If the mouth is quite swollen or anywhere around the lower jaw, then maybe get some crushed ice inside a tea towel and just put it onto the outside of your skin. Don't need to worry about putting it inside the mouth, but don't put it directly on the skin. Do make sure you wrap it in some cloth first. Your dentist should have made sure that you weren't bleeding after your tooth extraction. But if you do start to bleed again, hopefully they gave you a couple of packs for you to take away, and you can pop one of those into the mouth and bite down nice and hard. It's the pressure of you biting together which will help stop any bleeding. If you do find that you're unable to control any of the bleeding, then do give us a call and come back in to see us. A few do's and don'ts after you've had a tooth extraction. Do use your common sense. Try and eat away from the area where you've had the tooth removed. So if you've had it removed on your right hand side, try and just concentrate on eating on your left hand side, just to try and keep any debris from getting impacted, getting pushed into the socket and increasing the risk of infection in that area. Don't do any exercise that day. Take it easy after you've had a tooth extraction. Certainly avoid smoking, avoid alcohol and avoid excessive caffeine. You can have a tea or coffee, but try not to have too many. Again, that can encourage bleeding. You can use things like mouthwashes that will help after having a tooth extraction. You can use a chlorhexidine mouthwash, something like Corsadil, or hot salty water. Put about a teaspoon of salt into a cup of relatively hot water. Be very careful not to burn yourself, and don't do anything like this while you still have the local anaesthetic in effect. If you still feel numb, don't try and put a hot salty rinse into your mouth just in case you burn yourself. When you are using a mouthwash or a rinse, try to bathe the area rather than vigorously rinse. Now what I mean by that is don't put the liquid into your mouth and swish it around from left to right too much. What that can do is actually get in the way and disrupt the clot and cause the extraction site to start to bleed again. It's much better to simply bathe the area. And what I mean by that is to take the fluid into your mouth, keep it relatively still in your mouth for 30 seconds to a minute over the extraction site, and then just gently spit it out again. You may have had stitches as part of your extraction. Most stitches that we use are resorbable, which means they will dissolve by themselves. But otherwise your dentist may have asked you to come back in usually about a week's time to have those stitches removed. The most important thing is if you are having any problems, to give us a call. Typically with tooth extraction, problems tend to develop after 4 to 5 days. The main two are an infection in your socket or something called a dry socket. A dry socket is when you lose the clot, like the scab over your wound, and the bone becomes exposed and becomes very, very painful. If you're feeling a bit of pain after 2 or 3 days, that won't be an infection or dry socket. It usually doesn't tend to set in until that 4 or 5 day period. So if you're getting pain in the early period, just keep taking your analgesics, your painkillers. If after 4 to 5 days you're still struggling, you've got a bad taste, you have increasing pain, the pain is getting worse, then give us a call and you need to come in and see your dentist. If you have any further questions, just get in contact. Thank you.